Hi, everyone, welcome to this YouTube channel. Today we are going to discuss important multiple choice question from the subject pharmacology with deep explanation, and don't forget to like, subscribe and share, so we can start now. Question number 1. Patient with hypertension also suffers from essential tremor. Optimal treatment of the patient should include management with A. Prazosin, B. Clonidine, C. Metoprolol, D. Propranolol. Answer: laughing face. Propranolol is a non-selective beta blocker useful in a variety of cardiac conditions including hypertension. The drug is also useful in essential tremor where blocking the beta-2 receptor is beneficial. Metoprolol, beta-1 selective, is useful in hypertension but not essential tremor. Question number 2. Which side effect is associated with spironolactone? A. Alkalosis. B. Hirsutism. C. Hyperkalemia, D. Hypercalcemia. Answer: C. Hyperkalemia is characteristic of this drug and may lead to clinical consequences at high doses, or if patients fail to discontinue K+ supplements or ingest foodstuffs high in K+. Question number 3. Which drug will utilize the same signaling pathway as endogenous bradykinin on smooth muscle? A. Minoxidil, B. Nitroprusside, C. Theophylline, D. Cocaine. Answer: B. Bradykinin binds to endothelial receptors and causes the formation of nitric oxide, which signals through the cGMP pathway to relax smooth muscle. Nitroprusside utilizes nitric oxide and cGMP in a similar fashion to relax smooth muscle. Question number 4. In the management of a cardiac arrhythmia, lidocaine is to be administered by way of an IV loading dose. What variable must be known to calculate an appropriate loading dose? A. Renal clearance, B. Bioavailability, C. Volume of distribution, D. Lag time. Answer: C. Back to basic principles. Recall that to calculate a loading dose you must know volume of distribution and target plasma concentration. Since lidocaine is being given IV, its bioavailability is 100%, F equals 1, so no adjustment is required to the equation. Question number 5. Which one of the following drugs is most likely to cause symptoms of severe depressive disorder when used in the treatment of hypertensive patients? A. Captopril, B. Prazosin, C. Nifedipine, D. Reserpine. Answer: D. In addition to decreasing the storage of norepinephrine in sympathetic nerve endings, reserpine causes a dose-dependent depletion of brain amines, including norepinephrine and serotonin. Symptoms of depression are thought to be related to a functional deficiency in noradrenergic and serotonergic neurotransmission in the CNS. Question number 6. Outpatient prophylaxis of a patient with an SVT is best accomplished with the administration of A. Adenosine, B. Diltiazem, C. Esmolol, D. Lidocaine. Answer: A. Supraventricular tachycardias, SVTs, are treated effectively by Class 2 and Class 4 antiarrhythmics. In addition, adenosine is indicated for SVTs and nodal tachycardias but only acutely since it must be administered IV and has an extremely short duration. The primary actions of both beta blockers, esmolol, and calcium channel blocker, diltiazem, are at the AV node. Lidocaine is Class 1B drugs that are used in ventricular arrhythmias. Question number 7. Nitrates are the drug of choice for relieving acute angina. Nitrates work by A. Promoting vasodilation, reducing preload, and increasing afterload. B. Promoting vasodilation, reducing preload, and reducing afterload. C. Promoting vasodilation, increasing preload, and increasing afterload. D. Promoting vasodilation, increasing preload, and reducing afterload. Answer: B. Nitrates cause smooth muscle of the veins and arteries to relax and dilate. When veins dilate, less blood returns to the heart, thus reducing preload. Dilation of arterioles decreases resistance, thus decreasing afterload. Question number 8. A 55-year-old man with congestive heart failure is noted to be taking furosemide each day. Which of the following is most likely to be found in the serum? A. Decreased potassium level, B. Decreased uric acid level, C. Elevated magnesium level, D. Low bicarbonate level. Answer A. Furosemide leads to hypokalemia, hypomagnesemia, metabolic alkalosis, elevated bicarbonate level, and elevated uric acid. Question number 9. A patient arrives in the emergency room as a coma and has a serum Ca2+ of 4.5 m. You start a saline infusion of which of the following drugs? A. Calcitonin. B. Ethocrinic acid. C. Hydrochlorothiazide. D. Spironolactone. Answer B. Loop diuretics such as ethocrinic acid increase the excretion of Ca2+. Question number 10. A 65-year-old male with CHF exacerbation is given IV furosemide. Which of the following adverse events are not associated with this medication? A. Transient neurotoxicity from high dose. B. Hypotension. C. Worsening renal function. D. Hyperkalemia. Answer D. Furosemide infusion may cause transient ototoxicity with higher doses, hypotension, hypokalemia, and azotemia with possible worsening renal failure are all possible adverse events with furosemide. Question number 11. Losartan acts to decrease which of the following? A. At -1 receptor activity. B. ATR receptor A activate. C. Production of angiotensin II. D. Renin production. Answer A. Losartan is a prototypical angiotensin AT1 receptor antagonist. Question number 12. Which of the following is a limiting adverse effect of ACE inhibitors? A. Acidosis. B. Hyperkalemia. C. Hypernatremia. D. Hypokalemia. Answer B. By reducing aldosterone levels, ACE inhibitors decrease K+ excretion in the distal nephron. Question number 13. Which of the following is a usual effect of niacin? A. Increases HDL. B. Increases LDL. C. Increases total cholesterol. D. Increases triglycerides. Answer A. Niacin increases HDL, decreases total in LDL, cholesterol, and decreases triglycerides. Question number 14. A patient has a genetic polymorphism such that they cannot rapidly metabolize drugs by acetylation. You would be most concerned about this polymorphism if the patient was taking which drug? A. Sotalol. B. Clonidine. C. Nitroglycerin. D. Hydralazine. Answer D. Because hydralazine is metabolized by N-acetyltransferase. Associated with a genetic polymorphisms, patients who are classified as slow acetylators may develop SLE-like symptoms. When treated with hydralazine, other drugs metabolized via N-acetyltransferase, including isoniazid and procainamide.
Thank you for watching, and if you like this videos, please share and subscribe for more videos.